annual World Healthcare Congress meeting in Washington, D.C., new data is revealed all the time. I have with me now Frances Dare with the Internet Business Solutions Group at Cisco. And Frances, you have some exciting information to share about a survey that Cisco has just done with global health leaders.
We do, Mabel. We've been able in just recent weeks to look at findings from interviews and online research with 96 very senior world health leaders from 16 nations and 6 continents. And we found some very important themes that tell us how some very innovative things can be done in the near term to make healthcare better for citizens around the world.
And collaboration seems to be a very important aspect of progress going forward?
That's exactly right. The breakaway finding in the research was the opportunity to connect healthcare professionals across time, across distances, to collaborate with each other, to share expertise, to make care decisions together, to benefit patients where there may not be the right kind of healthcare professional in their local community, or they may benefit from having an entire care team be part of their consultation and care planning.
And through your survey, were you able to find out how best to really share this information?
It's a variety of approaches, things like being able to get data from electronic health records, and equally important, being able to have video interactions so that it's almost a live conversation as we're having now, or to be able to bring care teams together through video, through web conferencing, through audio conferencing. All of those approaches, in the opinions of these world leaders, have great value to overcome challenges with access to care and healthcare resource efficiency.
We're at a very important stage of change in the healthcare delivery system in the United States. Why bring in information from other parts of the world? Why include global health leaders in this?
It's a great question, Mabel. We've seen across the globe a tremendous wave of innovation and transformation really over the last decade, and certainly in the United States over the last 3 or 4 years with health reform legislation, the HITECH Act within the economic stimulus legislation. And we said, okay, so much has happened. What does that next wave of innovation potentially look like? We had some ideas, but we wanted to know what resonated with health leaders in the States and countries across the globe.
Well, speaking of across the globe, we have with me also Dr. Ahmed, who is with the Ministry of Health from the country of Pakistan. And Dr. Ahmed, we were speaking about this earlier, about really the need for more electronic health sharing, people really being able to access information from their homes. Tell me again what the situation in Pakistan is.
Well, the situation in Pakistan, just like any other developing country, is that around 60 to 65% of people do not have access to basic health care. Whatever healthcare resources we have in the form of HR, that's saturated in the larger cities. So we have an uneven distribution of decreased number of HR, and that actually adds to the challenges in a country which does not spend a lot of money on healthcare, which does not have a very good infrastructure, and which has a very increasing disease burden. So these are the challenges we are up against and we are fighting, and that's why we find eHealth a very useful tool.
Frances, when you were speaking or when you learned of this information from global health leaders, any of what Dr. Ahmed mentioned resonate with what the findings came back to Cisco with?
Absolutely. One of the examples that he shared was connecting specialist physicians in urban settings with primary care providers in other communities. So, and one of the things that you have found most valuable, you say it in your words better than I, was that exchange of knowledge, that ability to extend the expertise of the people that we're being consulted with. Perhaps you could describe that a little more fully.
Yeah, I would certainly, say a few words on that, because the first project which we started, which was focused on delivery of healthcare to people living in the rural areas, we found that the connectivity between the healthcare professionals in the larger cities, which were more educated and who were the specialists, with the doctors or physicians in the rural areas who were not so senior or specialized in their training. This connectivity actually helped them a lot, and they were very comfortable, especially the people who were presenting their patients. So I think that one of the outcomes of our telemedicine program, which was aimed in delivery of healthcare, was that these physicians who were participating in this program, whether they were in the hub or the spoke, they were actually very comfortable, and they liked this sharing of information, which was two ways, and they wanted more of it.
Mm-hmm. And you had mentioned also, Francis, that is one of your top concerns, to really maximize the ability to provide quality of care. So the sharing of information is even more important in that regard, isn't it?
That's exactly right, Mabel. If you think about those top three concerns, equitable access, best quality care, and efficient use of resources, all of those are uniquely addressed when you have programs that connect people in different locations and bring the best expertise without actually having to physically move a healthcare professional from one location to another.
Well, this all makes sense. Great information. Now what? What do we do with all of this that we know?
That's part of the conversation we're having with world leaders like these during the week at the World Health Congress. We can see a couple of next steps. In the survey, we suggested some scenarios for national programs that could have potential. And the feedback we got said that one of those in particular really resonated with these world leaders. It's the idea of clinical centers of excellence. So for a particular kind of condition, heart disease, diabetes, pediatric asthma, or for a certain approach to care, pediatrics. If you have that one center of expertise and you can make the health services, the care coordination, the clinical education available from that one center widely across the country through information and communication technologies, that could have a very positive impact in a realistic time frame to really improve health in meaningful ways.
Very promising. Thank you. So. Francis Stair, Dr. Ahmed, thank you very much.
Thank
I'm
you.
Mabel Jong at the World Healthcare Congress in Washington, D.C.